Okay. Hello, my name is Dr. Lindsay Hollywood. I'm from Ulster University, and today I'm going to provide you with an overview to a recent safe food project that I worked on. In March 2019, we were awarded the tender to assess consumer ownership and use of meat thermometers across the island of Ireland. And this was a one-year project led by Ulster University in collaboration with St Angela's College in Sligo and the University of Surrey. Also, our data collection stages were supported by market research company SMR Belfast. So today what I want to do is to provide you with an overview of the project design and just some of the results and recommendations leading from that. So we're just going to cover the project aim, the methodology, the results and the recommendations. So in 2018, there were 2.4 million cases of foodborne illness in the UK, and that is an increase from 1 million that was reported in 2009. And approximately 13% of all infectious intestinal disease is due to food poisoning. You know, in Ireland, between 2017 and 2018, the total number of recorded cases of food poisoning attributed to pathogens in uncooked meat was around 9,000. Now, it must be noted that often these official figures are higher than those reported for various reasons, including the fact that people maybe often do not self-report instances of food poisoning. So this highlights the importance of minimizing and mitigating the risk of food poisoning within the domestic environment. And really what we're hoping to do is to encourage the safe cooking practices and potentially using aids like meat thermometers to support that. So undercooked meat has been identified as a common source of foodborne illness and a public health concern. And given these reported rates of food poisoning on the island of Ireland, it's important to determine the adequacy of these guidelines in terms of the safe cooking of meat, and to explore the potential for encouraging consumers to use meat thermometers within a domestic setting. So current government advice on ascertaining the acceptability of meat for consumption varies between region, and here we're talking about the Republic of Ireland and the UK. So in the Republic of Ireland, current meat safety advice says to cut the meat to check to see if the juices run clear, check to see if the food is piping hot all the way through, checking that none of the meat is still pink. Whilst in the UK, they also recommend the same sort of thing, saying making sure meat is steaming hot and cooked all the way through, and to cut into the thickest part of the meat and check that none of the meat is pink or that any of the juice and that the juices run clear. However, one of the slight differences there is that within the ROI guidelines, thermometers are also presented as an alternative, but not the only means to assess doneness. And so we wanted to explore this area of meat thermometer usage a bit more. So the aim of this project was really to investigate current perceptions and trends on the use of meat thermometers by consumers on the island of Ireland, and to assess their behaviours and their attitudes towards meat thermometers and looking at their usage behaviour as well. So really we want to look at whether or not consumers use meat thermometers to assess the doneness of meat. So some of the project objectives are as follows here in the slide. Firstly, we wanted to investigate current perceptions and trends in the use of meat thermometers. We then went on to assess consumer behaviour and attitudes towards meat thermometers on the island of Ireland, as well as looking at what are the barriers and the motivating factors to using meat thermometers among consumers. And then finally, to look at those results and to develop recommendations for overcoming the barriers and raising awareness and in promoting the use of meat thermometers. So this was a three-part study. The first part looked at a rapid review on meat thermometer usage and attitudes towards meat thermometers. So we conducted a review of academic literature and also grey literature, specifically looking at government reports or food safety authorities within certain countries like UK, Ireland, USA, Canada, Australia and New Zealand, just to get an idea of what was being done there. A total of 12 databases were used along with keyword searches, and I'll show you the results of that literature review in a wee minute. But also within that then, the second stage of this study was to use focus groups to really understand those behaviours to meet thermometer usage. And so 6 focus groups were conducted across the island of Ireland, north and south, accounting for the urban-rural divide and also the east and west split. So there was 65 participants that took part within the focus groups, within 6 of these focus groups. 50 were male and 50 were female and 15 were male. And the reason being that we recruited based on the primary preparer of meat within the household. We also accounted for socioeconomic groups A, B, C, and 1, and C, 2, D, and E. So the third stage of this focus group looked at a survey. So we conducted a survey across the island of Ireland, across 107 different geographical regions, and that ended up with over 1,000 participants within the survey. The survey looked at key areas such as perceptions and barriers to using meat thermometers, meat safety knowledge and meat handling practices, as well as the decision making regarding the pros and cons of using a meat thermometer, the frequency of use in using a meat thermometer, and also we looked at the whole trans-theoretical model of change, at which stage were consumers in relation to their meat thermometer usage, as well as then socioeconomic and demographic indicators. So this actually was a really exciting study in that, throughout each one of the stages, we found support as we went along from stage 1 that informed stage 2. And like one example would be that using that trans-theoretical stages of change model, determine which stages of readiness consumers are at, so as to understand, how we can influence their behaviour. What we actually found across stage 2 and 3 of the study was that the majority of participants were at this pre-contemplation stage, meaning that they maybe had never even thought seriously about meat thermometers or about changing their behaviour. So it was quite an interesting study in that sense. So I'm just going to show you some of the results from it. In terms of the rapid review, so after we conducted a lot of the keyword searches across those 12 databases, we came and we screened each one of those studies and came up with a final sample of 44 papers. And as you can see from the results of these 44 papers, the majority of work has been carried out in America and Canada as well. So some of the key insights from that rapid review were showing that meat thermometer use has steadily increased in the USA and Canada since 1998, with an increase from 49% being observed in 1998 to 70% in 2010. Now, a lot of that might have been attributed to the fact that within America, they did a lot of very targeted campaigns on how to cook meat safely. And, as we go through this presentation, we can maybe touch on that. But what was quite evident was that when you looked at Europe, the research was pretty sparse, and studies indicated that usage was actually lower than in USA and Canada within Europe, with meat thermometer usage trends of maybe around 11% and only 2 to 4% usage being observed among British and Irish consumers. So in terms of then as well, the rapid review, we wanted to get a sense of what are the barriers or what are the facilitators preventing people from using a meat thermometer. So some of the motivations, the facilitators included that, if a meat thermometer was demonstrated as easy to use, then that would encourage people to use one. Or if it was, if they were shown to actually reduce the risk of foodborne illnesses, people would be more likely to feel reassured, around using the meat thermometer. Also, one of the other motivating factors was that if they assured the safety of cooking for children, as well as if they viewed it as if the meat thermometer improved the taste or the texture of the meat, certainly then they would consider using this. We did identify a number of barriers around the use of meat thermometers, and really, the use of all these other alternative assessment methods for assessing the doneness, like just looking to see if the meat was pink or if the juices ran clear, were thought to actually be more effective. People within the literature, consumers were saying that it was deemed a hassle and that it was inconvenient to use. It was just another thing to think about within the cooking process. And some evidence was shown that, people find it difficult to use a thermometer as well. Interestingly, one of the barriers was that it wasn't deemed a social norm. So, if you weren't watching others using it and it wasn't part of the daily cooking process, then, they were less likely to use it. Another couple of barriers around the use of meat thermometers was the lack of understanding how to use a meat thermometer, the lack of instructions of how to use a thermometer correctly in terms of assessing the temperature, and that people actually thought they were quite expensive to buy as well. Some of the final results from our literature review, really we wanted to look at some of the campaigns that had been done, and what we did find that we did find a gap that there were no studies identified on the effectiveness of campaigns in relation to meat thermometer usage in Europe and the UK or the Republic of Ireland. However, we did find these studies that I previously chatted about in America. So the Fight Back and the Thermi campaign ran, as well as Is It Done Yet? So really these campaigns sought to educate consumers about the doneness of meat and when it was safe to eat meat. So then going on to our focus group results. And really here, just to remind you, there were 65 participants in this focus group. And the number one kind of method for assessing the doneness of meat, was really that they checked that there was no pink meat and that the juices ran clear. So just to go back up to that first bullet point to talk you through some of the results there. 1/6 of consumers at least occasionally use a thermometer to assess the doneness of meat, and results show that the vast majority of participants did not own or even use a meat thermometer, which we found very interesting. And again, we found similar results whenever we went to do the survey. Participants were more likely to employ a meat thermometer on larger pieces of meat than smaller pieces of meat, such as sausages or burgers or thighs. The most commonly reported measure, of assessing the doneness of meat, as I said, was to check that there was no pinkness and that the juices ran clear. But just to reiterate that practice was most common when cooking poultry. So from these findings, there were two themes. If it looks okay, then it's done. And if I overcook it, it'll be okay. So really we were seeing here two broad practices that consumers were undertaking to assess the doneness of meat. So just looking at theme one, really there, if it looks okay, then it's done. Consumers use these two visual cues to assess the doneness of meat, whether the meat was changed color and it was browned, and secondly, whether the juices ran clear. So these two visual checks help them to assess whether meat was done. So in terms of color or browning, you can see some of the quotes here down the side. So I'm just going to talk you through these. So really the majority of participants discussed how using color or browning on meat provided a sense of reassurance that it was safe to eat. Using colour as an indicator was probably most commonly expressed in discussions regarding light-coloured meats such as chicken, turkey, and other forms of poultry. When we look down here at the next quote around the juices running clear, this was often used when discussing cooking meat safely regarding poultry, especially chicken and turkey as well. So both these cues actually were often used in conjunction with each other, with participants often listing one and then very quickly listing the other, like the colour and the juices running clear. What was interesting as well within these results was that a third visual cue recommended by Safe Food as to, checking to see whether the meat is piping hot was actually only reported by one of the 65 participants who stated, "I just stick a knife in it, and if it comes out steaming, it's cooked, and if it doesn't, it's not." And that was by a participant in Dublin, a female participant from ABC One Group. So these results highlight that no other visual cues like texture or blood were identified, when discussing this issue across the focus groups. The second theme, if I overcook it, it'll be okay. So really what we were seeing here were that consumers were using two methods to assess the doneness of meat. And that was firstly to either extend the cooking time or secondly to actually burn the meat. So in terms of extending the cooking time, almost half of all participants, so 31 of the 65 participants stated that they would intentionally overcook meat to ensure it's safe. And there was a lot of chat around the overcooking of meat, and burning meat occurred more frequently actually in C2DE focus groups. So in several instances, we were seeing that participants would simply state that they maybe overcooked their meat without elaborating on how they would do so. But overcooking mainly consisted of participants stating that they intentionally left the meat in the oven for longer than the recipe or the packaging called for. In terms of then burning the meat, this was less common than overcooking by leaving the meat in longer, and yet it was stated by at least one participant in 4 focus groups, including all the C2DE focus groups. Burning was more commonly reported when discussing smaller cuts of meat, such as sausages, burgers, and bacon rashers. Although some participants also referred to burning steak, chicken, and maybe some forms of meat in general. So just moving on, within the focus group then, participants were given practical tasks, and participants were asked to firstly identify the correct insertion method for meat thermometer in 4 different types of meat, as you can see on the left-hand side here: the roast, the chicken thigh, the whole chicken, and the burger. And they were also asked to identify what temperature they believe meat should be cooked to in order to ensure that it was safe to eat. And actually the results were quite surprising. So the majority of participants in the focus group were able to identify the correct insertion points of meat of a meat thermometer on the images of the roast. So 69% were accurate, while that kind of dropped to 57 within chicken thighs, and only a minority were correctly able to identify the word to correctly insert the thermometer on the whole chicken and on burgers as well. In terms of responses to the questions, well, what temperature should meat be cooked to ensure that that the meat is safe to eat? You can see here on the figure to the right hand side that actually overall participants did have a pretty poor understanding of the appropriate endpoint temperature of meat. So just to remind the listeners here, the Safe Food recommended safe endpoint temperature is 75 degrees. So a total of 34 participants stated that they did not know the correct endpoint temperature of meat, and of those 31 volunteered responses, the mode temperature was given 180 degrees. So really we could see a range here from 60 to 250 degrees. Within the focus groups, we wanted to see if our findings from the rapid review were confirmed, or if we could identify any other barriers or facilitators to meat thermometer usage. So as we could see here, some of the main barriers were that people perceived meat thermometers to be actually quite expensive and outside of their price range, calling it a high cost hindrance to the cooking process. We also found one of our strongest barriers was that it was not a home life habit. So it wasn't a social norm that was established within the home. Participants had overwhelmingly had said that they had never seen their parents or their grandparents or their friends ever use a meat thermometer. So that lack of exposure, especially when growing up and learning how to cook, was not present within the home environment for many of these consumers. Also, another barrier was that it was deemed a troublesome tool. And I know that is something I've already talked about, but it was perceived to be a bit of a hassle. Their thermometers were maybe perceived to be difficult to maintain. They'd contribute to the kitchen clutter, and it was just another complication when trying to prepare dinner. There was also a widespread sentiment apparent across all the focus groups that meat thermometers were really a professional item, used for chefs, and really not needed in the home. And that was a frequent remark from a lot of the participants within the Dublin focus groups, that chefs use them and that they have to use them. But also for some, they were saying that for those that don't cook, that was when, and are learning how to cook, that's whenever they should use a meat thermometer. In terms of the facilitators, the things that were encouraging people to use a meat thermometer, some consumers chatted about the sense of duty, the meat thermometer itself being a socially responsible aid, whereby this participants felt a sense of duty to prepare safe food for those that were maybe dining within their home, whether it be just their family or their friends within the home environment. Another facilitator was that it was an implement for improvement. What we were seeing here were participants were stating that they might be motivated to use a thermometer if they felt it improved the texture or the taste of the meat. One response from a focus group in Galway said, you'd cook it better rather than overcooking and spoiling it. You'd learn a better way of cooking if you used a meat thermometer. However, this sentiment was actually absent from focus groups, C2DE focus groups. Another facilitator was that of it being a foolproof appliance as well. So though not motivators per se, many participants stated that they thought a thermometer would be easy to use, and stated maybe a slight curiosity or willingness to try to use a meat thermometer. And finally, another facilitator was that if it was a freebie, of course, we all love something free. And in all C2DE focus groups, participants stated that they would be more likely to use a meat thermometer if they were freely distributed. So just to summarize some other findings from the focus group as well, we actually explored, how consumers preferred to find out about the safe preparation of meat. And, a lot of them said that their preference would be through personal communication, through word of mouth, and maybe via the butcher, and also through instruction materials such as like recipe leaflets. So just moving on then to look at the survey results. Here you can see the characteristics of the survey. So as I had previously said, there were over 1,000 people within that sample, 51% in ROI and 48% in NI. And the majority of the survey sample were female, 67% in ROI and 67% in NI as well. And we have, as you can see, I'm not going to read it all out, but as you can see, there was a good range of participants undertaking the survey across socioeconomic groups, education level, as well as household type. So in terms of the survey, some of the areas we looked at was looking at measures of checking doneness of meat as well. So what we were seeing was the most commonly employed measure of checking the doneness of meat, which you can see there on the right hand side in figure 2, was inserting a knife into the meat, followed by the juices running clear at 40%, timing as well, and following instructions on packaging at 35%. So only really from these results, a small minority of respondents, 15.7%, actually reported using a meat thermometer. Only 1.9% of the sample followed the safe food recommendation of combining all three of the methods, checking to see if the juices ran clear, checking to see if there was any pink meat present, or checking to see if meat was piping hot. Just moving on, really what we could see here was that participants did have a poor understanding of what core temperature meat should reach for food safety. And when we were looking at the perceived safe endpoint of the temperature of meat, 55%, and so that was 579 participants stated that they did not know what temperature meat should be cooked to. Responses range, as we led on from this question, the responses range from 30 to 260 degrees, with the mode being 180 degrees. So, again, this was different compared to what the advice is at 75 degrees. In terms of the meat thermometer usage, we wanted to explore the results a bit more, looking at users versus non-users as well. So 17.4% of respondents stated that they owned a meat thermometer, and of those respondents, 57% said that they owned a digital thermometer, 21 owned a dial thermometer, and 5.5 owned a liquid thermometer. Participants in the socio-economic bracket ABC1 were more likely to own a meat thermometer than those in C2DE. Also, education had a role to play within this as well, as participants with higher levels of educational attainment were more likely to own a meat thermometer. And whenever you compared non-users, current meat thermometer users were more likely to agree that a meat thermometer is a necessary tool when cooking in a restaurant or deli counter, and a meat thermometer is a necessary tool when cooking at home, and that food poisoning poses a risk to them. So really here, we were looking at, we were seeing that 17.4% reported that they owned a meat thermometer, and that the three most commonly reported motivations for their meat thermometer ownership was that it was given as a gift. It maybe was bought because it provided a sense of safety, and it also provided a sense of certainty as well. So there was an ownership usage gap of only 1.7%, which is actually quite low compared to a lot of the American studies, which we found within the literature review, that said that there was typically an owner usage gap ranging from about a gap from about 18%. So, when I'm talking about the ownership usage gap, I'm meaning those who owned a meat thermometer but maybe did not use one. So participants also stated that they use meat thermometers always or often, most commonly on turkeys at 15%, followed by whole chicken and roasts as well. So just some other findings from our results then. What we're seeing here is that most respondents believe themselves to be confident cooks at 76% and felt responsible for the safety of others. More people agreed that a meat thermometer was a necessary tool in a restaurant in Delhi than actually in a home setting. And according to the trans-theoretical model of change, the majority of participants, 86%, were in this pre-contemplating stage, of the behavior change. So they'd never used a meat thermometer or had even thought about using a meat thermometer. Around a third of participants as well stated that they did not know how much meat a meat thermometer would actually cost. And a total of 15% of participants stated that they would not be willing to pay for a meat thermometer. And this did differ, though, according to the location between ROI and NI. So taking all those results into consideration, then, really what we were seeing here was that meat thermometer usage does remain low globally, and that only the USA and Canada actually recommend thermometers as a primary approach to assessing the doneness of meat. There was also a low level adherence to Safe Foods recommended methods of checking the doneness. Now we're talking about using all three methods. But only 1.9% of the survey sample reported combining all three methods of checking to see whether the meat was done. So this research provides the first really comprehensive analysis of meat thermometer usage and the related attitudes and behaviours on the island of Ireland. So we have quite a few recommendations stemming from this study, and I'm not going to read out every single one of them, but I will touch on some. But basically, to summarise, what we are seeing is that people don't really use the meat thermometer, but based on their stage within the trans-theoretical model of change, they are potentially open to using a meat thermometer. So what we're saying is that campaigns really do need to be focused on education and really promoting the use of meat thermometers through mediums that they trust, for example, packaging like the butchers, through word of mouth as well. So one of the recommendations there, the first one, was to encourage people to begin using a meat thermometer. As I say, most were in this stage of change, where they'd never thought of using one, but also to educate people regarding how to correctly use a meat thermometer and to educate them around the safe endpoint temperatures of meat in all cuts of meat as well. So just moving on, some other recommendations included, maybe integrating instructions on how to use meat thermometers into free recipe leaflets. As many participants did state that getting instructions on how to cook meat, was what they liked from these. Also, in terms of promoting one's social responsibility and emphasising that food poisoning is a serious risk even when at home cooking, is something that really does need to come through in those communication campaigns. One to pick up on here as well was really looking at emphasising the affordability of meat thermometers, given the fact that many consumers did say that it was perceived as a barrier. So other recommendations around communications, also maybe encouraging just meat thermometer usage in general, and making it really a domestic tool to assess the doneness of meat. And also it was saying we find that any future interventions really should focus on non-users, or should assume that users have no prior knowledge regarding meat thermometer usage. So really taking them right through that process and educating them in that. So as you can see, there are even more recommendations here, but some we've already touched on. Just saying that campaigns should employ maybe using recipe leaflets, or information should be presented via the butcher shop or in meat aisles as well, or on packaging. And just as well, some other recommendations, really it was saying here that any interventions which desire to specifically encourage meat thermometer use on whole chicken should aim to communicate that meat thermometers are easy to use. So it's just about trying to really reassure consumers that this is a really useful tool to assess the doneness of their meat and to ensure meat safety within the home environment. So just to say thank you very much for your time, and yeah, hopefully you have enjoyed this presentation.